is Dr. Marie Steinmetz, and I'm a family physician and an integrative medicine physician at Steinmetz Center for Integrative Medicine. Integrative medicine is a new field of medicine. It's about 10 or 15 years old, and it really tries to integrate other modalities into our patient care and treatments, like acupuncture, herbs, Chinese herbs. We have a strong emphasis on diet, exercise, how we deal with stress in the practice. In our practice, we have a number of things that we do in integrative medicine. We have an osteopathic physician, so we have some manipulation available, which is great for things like headaches and musculoskeletal problems. All of our doctors here also do acupuncture. We've incorporated herbs, homeopathic treatments, Chinese herbs. We also have a program called Heart Math that helps with high blood pressure and sleep disorders. We have a nutritionist here because we feel like diet is a very important part of everybody's health. We do all the things that you would normally find in your family practice office. But we also see a lot of patients with chronic diseases. In conventional medicine, we're giving just a lot of drugs that are treating the symptoms, but we're really trying to get to the root of the problem. We actually are trying to use the body's natural defenses to get better, so people aren't necessarily on herbs forever. They're not necessarily getting acupuncture forever. So the thing is to really work with the body, get to the root of the problem, and get the patient as healthy as they can be. So integrative medicine was really probably started, where people 10 or 15 years ago started talking about holistic medicine. And what happened was doctors started realizing that we're not really doing what we wanted to do in helping patients by just giving them a drug. The advantage of integrative medicine over conventional medicine is, I think the first thing is we really try to work with the body's own defenses. In general, people in the long term will save money because they're not going to be on prescriptions for a long time, really for the rest of their life, and they're going to feel better. Once we get to the root of the problem, patients feel better. We really like to partner with the patients and work with them. So maybe somebody really is not at a place where they can make a major change, say in their job commute, which is stressing them. But maybe we can help them learn how to deal with stress a little bit better, and we have some tools for that. Maybe there's an herb that will help them with their anxiety. So I think the first misconception, and the main one that is a problem for people, is they think there's not science behind it, but there actually is a lot of science behind what we do. The most important thing we do for our patients is spend time with them, because one, we want to have a relationship, and two, we really want to hear their story. First, when a patient would come in, we would do a very thorough history and physical. We would work on their 4 pillars: what's their diet, what's their exercise, how are they dealing with stress, and how is their sleep. Then we would start some conventional testing as well as some integrative medicine testing. We may give them some elimination diet, we may do some other supplements, and then we would see them back for visits until we felt that they were healthy. And our goal is that people should be so healthy they only have to see us once a year.